Hello, my name is Kalina, and today we're going to be discussing ulcerative colitis. I chose this topic because a dear family member of mine has this disease, goes through it, and I see on a daily basis how much it affects him, how much it affects our family, and it's common. Those around us can have it, and many times we don't even know about it. So I just kind of wanted to shed some light on this disease. So what is ulcerative colitis, and why is it important to us? Ulcerative colitis is basically a type of inflammatory bowel disease. Is also considered an autoimmune disease, such as Crohn's disease. It basically attacks or occurs when the white blood cells or fighter T cells attack the body's own large colon or large intestines. So typically, it is characterized by ulcers or bumps in the around the rectum, sigmoid, and lower colon. And every time there's food that passes by, or there's bowel movements, anything going on, those ulcers are just constantly getting, struck on, and they're agitated and they're aggravated, so it's really painful. It's a painful disease to be living with on a daily basis. So I'm going to be kind of going over the causes, signs, symptoms, who's affected, and treatments, and so forth. So causes of disease, they're still not fully known. The most common ones that people assume are environmental factors, are immune dysfunctions, and as well as genetic predisposition. So environmental factors, stuff like bacteria, viruses, medications, they can aggravate it, they can lead to this. If there's irritation in the pH level or any of that thing going on, that can kind of lead to or it can have higher chances of introducing ulcerative colitis into the body. Immune dysfunctions, if someone already has a pre-existing autoimmune disease such as Crohn's disease or any of the sort, that they also have a higher chance of getting ulcerative colitis. And then also genetic predisposition. So if anyone in the family, a parent, a relative has it, a close relative, the risk may be higher. Diet and stress, people used to assume that diet and stress caused ulcerative colitis, but that just aggravates the already existing disease if you have it. It does not cause it necessarily. From what studies have been showing, there's no link to having diet and stress cause the disease. It can only aggravate it if it already exists. Some signs and symptoms, they may vary from mild to severe, stuff like bloating, fatigue, blood in the stool, joint pain because of the autoimmune disease, just generalized abdominal pain, ranging from severe to mild to severe. You can also have weight loss, loss of appetite, and again, I say joint pain, fever, all of that stuff can occur during flare-ups. So basically, when the body flares up, it hasn't experienced a symptom in a while, and then during this flare-up, the symptoms become more aggressive, and you start feeling it more than during the time of remission of no symptoms. Stuff that may trigger flare-ups include food and stress, typically, as mentioned. Foods such as alcohol, nuts, fibers, spicy foods, high doses of typically alcohol that would aggravate the stomach, that would aggravate the disease, and that would cause a flare-up. Stress can also, long periods of or high doses of stress can also cause a flare-up in the lower colon. Figure 1 shows a comparison between a healthy colon versus an inflamed colon. Clearly, as you can see in the healthy colon, you see that nice, you see those pouches, the house straw, you see a nice passage there in the large colon, versus in the ulcerative colitis colon, you can see all that inflammation, all that redness. That's a barely intact hole. You can barely, food without you passing through that would be extremely painful for that individual. So who's affected? There's a rather broad and extensive kind of amount of people that can be affected by ulcerative colitis. Typically, studies have shown that a lot of people in North America as well as Western Europe, the majority of people have been experiencing in those two continents. And whites, people of Jewish descent, males rather than females, individuals between 15 and 30 and older than 60, and then again, people with already existing autoimmune diseases. Some diagnoses, or that can help us, tell if you have this disease or if we have something else that's going on. There's lab tests, there's stool tests that can be done. There's different modalities, which I'm going to go into in just a second. You can also do a colonoscopy, which is basically where you insert a kind of like a scope with a little video camera into the rectum, and it kind of we help us see if there's ulcers, if there's mucous membranes, stuff of that sort. The imaging modalities that would help us see whether a patient has ulcerative colitis would include x-rays and CT scans are the primary ones. X-rays, typically on an abdominal x-ray, you can't really see it too well. You can see that kind of mucous membrane, you can see the thickening of the mucosal wall. However, if you do a barium enema, which is a double contrast study, going up the rectum, it kind of outlines it a lot better, and you could see it much better, much more clearly. For CT scans, it has the same result same kind of views as a barium enema would have. It would show everything nicely plus more. It would kind of show the colon wall, the distal ileum, and any potential perforation, stuff of that sort. So as you can see in figure 2, the barium enema, you can see how that contrast is kind of coating that. You can see all those ruffles in there. It's not like a smooth colon. You see all those bumps. That's the ulcerative colitis. Those are all the ulcers they're causing in the large colon. And in figure 3, in the CT scan, you can see those kind of grainy areas. That's also the large colon being affected by ulcerative colitis. CT scans don't require contrast, unlike barium enema, but they are more expensive. There's some disadvantages to that, so it's up to the doctor's discernment which to order. Some of the treatments can, so there's no cure for ulcerative colitis, but there are treatments that can help kind of subside the flare-ups and the side effects, the symptoms. There's medications. There's, of course, a healthy diet. You can, less fiber diet, high in fats diet, no nuts diet, stuff of that sort. You can also have medications or use medications like anti-inflammatory medications to help kind of decrease joint pain and suppress the body's own immune system rather than rather than reducing the body's own immune system. And then also the immunomodulators, which kind of help suppress that immune system too. The last resort that you would use for ulcerative colitis for patients suffering with it, if no medication helped, if no diet helped, would be to surgically remove the large, either partial or the entire large colon. And of course, with that, there are side effects, there are downfalls. You would have a lot more frequent bowel movements and a lot more watery bowel movements. For the conclusion, finally, as a prognosis, typically people with ulcerative colitis, they lead a pretty full, healthy life. They're restricted to some activities. You must have a lot of bowel movements more frequently. However, if the flare-ups are typically mild, symptoms are typically mild, they can have all those different treatments that we just stated above, and yeah, it's typically pretty manageable. So thank you for listening to that, and hope you learned something from this PowerPoint. Thank you.